Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about very important topic, that is anti-tuberculosis drugs. Okay. First of all, what is the causative organism for tuberculosis? That is Mycobacterium tuberculosis. There are two lines of drugs will be there. First line and second line, and some newly discovered drugs also there. Okay. Main for exam purpose, first line is very important. In second line, some injectable drugs are important. Okay. In first line drugs, isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin. Okay. In rifabutin, rifampicin also becomes regarding first line only. Second line drugs, thioacetazone, ethionamide, cycloserine, kanamycin, amikacin, capromycin, aflux, levoflux, moxiflux, and linezolid. Okay. The second line drugs mostly they are injectable drugs. Okay. First line drugs are oral drugs. We'll discuss each drug and detail. Okay. First is isoniazid. This is first line drug. It is a prodrug and bactericidal. Here every point is very important because they can ask anything in the MCQs. Okay. Isoniazid is a prodrug and it is a bactericidal. It inhibits enzyme ketoenol reductase. Okay. This enzyme will be required for mycolic acid synthesis, that is bacterial cell wall synthesis. Okay. Thereby it will inhibit cell wall. That means it is by inhibiting enzyme ketoenol reductase, there will be lacking of formation of cell wall. Obviously lacking of formation of cell wall. That's why it is a bactericidal effect. Okay. Next, it is effective against rapidly multiplying bacilli only. Okay, these are very important. Okay, it is effective against rapidly multiplying bacteria, and it has maximum CSF penetrations. Okay, and it is metabolized to liver by acetylation process. And this drug isoniazid will get resistance by mutation of CATG and INHA. These are MCQs. Okay, they are asking the resistant genomes also, whether CATG and INHA. This isoniazid is used as a prophylaxis of tuberculosis. Okay, this is regarding isoniazid, and next we will see the adverse effects. In see the adverse effects of isoniazid is mainly peripheral neuritis. Okay, we can inhibit this peripheral neuritis by giving pyridoxine. Okay, next hepatotoxic, it is a hepatotoxic drug. Obviously, it will induce hemolysis in G6PD deficiency patients. It may cause optic neuritis, psychosis, gynecomastia, and lupus-like syndrome. Okay, here main adverse effects will be peripheral neuritis and hepatotoxic. Okay, that is regarding isoniazid. Next is rifampicin. Okay, rifampicin also bactericidal drug. It inhibits DNA dependent RNA polymerase. Okay, they can ask MCQ like DNA dependent DNA polymerase, RNA dependent RNA, DNA dependent RNA. So it is first DNA followed by RNA. DNA dependent RNA polymerase. It interferes, that means food interferes its absorption. So it has to be given with empty stomach. Okay. Next, undergo enterohepatic circulation. It is safely used in renal patients. It is most effective and fastest acting drug in leprosy also. Okay. Here main MCQ will be this rifampicin is very safe in renal patient. It has to give an empty stomach. Third one will be it is most effective and fastest acting drug in leprosy patients also. Okay. Because of rifampicin is an enzyme inducing, it is having drug-drug interaction properties. Okay, that means that the other drug will be decreased. The effect of other drug will get decreased because of its inducing property. Next, rifabutin is also used in, because of rifampicin. There are other drugs in rifampicin analogs will be rifabutin, that is used in TB patients who are having AIDS. Okay, that means rifabutin is used in TB in AIDS patient. Okay. This is regarding rifampicin. Here main MCQs will be DNA dependent RNA, safe in renal and leprosy patients also we can use. Okay. In TB patient we can't use rifampicin. It is rifabutin. Okay. TB, that's why it's B. Rifabutin will be useful in TB. Okay. Next. Next ADI regarding rifampicin. Obviously orange color urine. This is a recently asked MCQ. Orange color urine will be formed by rifampicin, and orange color staining contact lens. Okay. That means one is urine, it will be orange. Second one will be contact lens staining will become orange. Okay. Third one is hyperbilirubinemia without elevating liver enzyme. That is SGBT elevations. Okay. Without SGBT elevation will cause hyperbilirubinemia. Next drug will be pyrazinamide. Okay. In pyrazinamide also bactericidal drug. It is most effective against slowly replicating bacteria. This is the difference. Fast replicating bacteria, isoniazid. So slowly replicating bacteria, pyrazinamide. Okay, that's why here every point is very very important. We have to remember thoroughly. Okay, it is a best sterilizing agent. Okay, effective against intracellular mycobacteria. Okay, this is an MCQ recently asked. That's why I am stressing this. It is intracellular mycobacteria and slowly replicating bacteria. Okay, that's the two major difference. Slowly is pyrazinamide. Fast means isoniazid. Okay, pyrazinamide is effective against intracellular bacteria. Extracellular will be different, which is in the next slide. Okay, what is the drug? So adverse effects of pyrazinamide will be hyperuricemia, hepatic dysfunction, and photosensitivity. Okay, next. Next is ethambutol. Ethambutol is a bacteriostatic. That's the fundamental difference. Okay, all first line drugs are bactericidal. Okay, except ethambutol, it is a bacteriostatic drug. It inhibits arabinogalactan component in cell wall by inhibiting enzyme arabinosyl transferase. Okay, by inhibiting this enzyme, it will show bacteriostatic activity. It is distributed all over the body except CSF, and this ethambutol will causes mainly visible disturbances. Mainly, what are the symptoms? Optic neuritis, central scotoma, loss of color differentiation, mainly between green and red. Okay, and these drugs doesn't cause hepatotoxicity. They are safe in hepatic patients. Okay, next is contraindicated in children. Adverse effects will be hyperuricemia, peripheral neuritis. Okay, here main important will be it is a bacteriostatic, safe in hepatic patients, distributed all over the body except CSF, and will cause visible problems. Okay. Next drug will be streptomycin. It is a cidal drug, obviously active against extracellular bacteria. Okay, intracellular bacteria, pyrazinamide. Okay, extracellular bacteria, streptomycin. It doesn't cause hepatotoxicity. That's why it is also safe in hepatic patients. Contraindicated in pregnancy because of streptomycin, which will causes obviously fetal abnormalities. So obviously it is contraindicated in pregnancy patients. Okay, next. Next is regarding newer drugs. Okay, coming to the newer drugs. Newer drugs will have first drug will be bedaquiline. This is a recently frequently asking MCQ. It inhibits mycobacterial ATP synthase enzyme. Okay, this enzyme has to be remembered. It is a ATP synthase. It inhibits mycobacterial ATP synthase and used in multi-drug resistance TB. Main side effect of this bedaquiline is QT prolongation. That's why cardiac patient we have to be very careful. Next new drug will be dilamanid. Okay, it inhibits mycolic acid synthesis. Side effect also samely like bedaquiline, QT prolongation will be there. Next drug will be rifabutin. Okay, rifabutin we already discussed. It is used in TB patient in AIDS. TB along with AIDS will use rifabutin. Okay, it is less effective against TB, more effective against Mycobacterium avium complex. Okay, longer acting will be because of its TF will be 45 hours. It is a long acting drug. And inducing drug, normally rifampicin is an enzyme inducer. This drug is having less enzyme inducing property. And next coming to the side effects, they will cause pseudojaundice and polymyalgia. Okay, this drug will be used in TB patient. Okay, along with HIV. Okay, next it is more effective in Mycobacterium avium complex. Longer TF will be there. Okay, this is regarding bedaquiline, dilaminate, and rifabutin. Next will be last will be drug resistance TB. There are four types of drug resistance: mono drug, that is single drug resistance; poly drug, multi drug, and extensive drug resistance TB. Okay, in mono drug means whether it is first line drug, any one drug in first line oral drug except rifampicin. Okay, polydrug resistance means two or more. Okay, that is any two drugs in first line except isoniazid and rifampicin. In multi-drug resistance means resistance to isoniazid and rifampicin. We call it as a multi-drug resistance. Extensive drug resistance means multi-drug resistance. That means the resistance to isoniazid and rifampicin. Any one fluoroquinolone, that is Aflox, Norflox, Levoflox, or one line injectable. That means any amic acid, streptomycin. These injectable drugs also, whether the bacteria will have resistance to isoniazid rifampicin, any one fluoroquinolone, and one second line injectable. Okay, this is called as extensive drug resistance TB. Okay, Next important is in this TB, that is atypical mycobacteria infection. Mycobacterium, it is caused by Mycobacterium avium complex, that is MAC. It is mainly caused CD4 cells will be less than 50 will be their count. The drugs we are using here will be rifabutin. Rifabutin will be more beneficial in MAC and other times samely aids with TB patients also. Next, ethambutol will be used and clarithromycin or azithromycin. Azithromycin will be once in a weekly dose because of its long acting. We'll use once in a weekly dose. Okay. So what are the drugs? Three drugs: rifampicin, ethambutol, clarithromycin or azithromycin. Any one of these things. Other drugs will be quinolones and amikacin. That is second line injectable drugs will be used. Okay. This is regarding anti-tuberculosis drugs. Very very important here. Every point is an MCQ. So you have to thorough. Okay. That's all. Thank you.